I'm going to take you to the journey of abdominoplasty from the time that you come to my office for consultation until you finish with the final recovery. Now, when you come for a consultation, obviously the consultation is a free consultation, so I will spend around 45 minutes to go over your history and perform a complete physical exam to determine whether you are a good candidate for abdominoplasty or tummy tuck. And normally people who have good firm skin with a firm abdominal muscle, they have a better chance of getting better results. But essentially a lot of people that they come to the office, they have sometimes poor abdominal wall skin because of multiple pregnancies, and they have significant scarring or stretch marks from previous weight loss or multiple pregnancies. And even those people, there are good candidates still for abdominoplasty because you can remove that scar tissues or stretch marks with the abdominoplasty. Essentially, during the first visit, we go over the medical problems and people who have diabetes, or they take blood thinner medications, or there are a steroid, they have a higher risk of developing complications during or after the operation. And those people, they need to have a medical clearance prior to the surgery in order to be optimized for abdominoplasty or tummy tuck. So the blood sugar needs to be very tightly controlled, and obviously if your blood sugar is out of whack or extremely high and you're not compliant with the medication, you're not a good candidate for surgery. The other problem is people who are smokers. The smokers are extremely high risk for complications related to the wound, and they have high risk of a necrosis of the skin after this type of operation. So we basically don't operate on patients who are currently smoking, and the recommendation is to stop the smoking at least 2 weeks prior to the surgery. The other issue that we need to address is your weight. The way we calculate the number is called BMI, which is the subtraction of your weight and your height. And if your number is above 30, it means you're extremely obese or morbid obese. You need to go under a sort of a whether diet regimen to lose weight to get below the BMI of 30 before you go under this operation. People who are extremely overweight, also they need to go under some sort of a bariatric surgery, which is the weight loss operation, before they can be a candidate for tummy tuck or abdominoplasty. The other most important thing is the patient's expectations. Obviously, when you have a smaller abdomen and less abdominal wall laxity and less fat, your result is going to be much better compared to someone that has a significant amount of scarring and very poor quality of skin. And those people, they're going to have significant improvement compared to prior to the surgery, but obviously it might not be a model-like results at the end of the operation. So obviously the appropriate expectations of the patient is very, very important. So the time of the consultation, we spend some time to make sure that they understand the results and what they need to expect. After the initial consultation, I send my patients for initial workup, including the simple blood work that they need to do. Obviously, if the patient's above age 40, they need the EKG, and if they are above 50, they need to have a chest X-ray. If the patient is currently smoking, obviously we do not operate on them, but if they willing to stop the smoking for more than 2 weeks, then they also require to have a chest X-ray prior to the surgery to evaluate their lung. These patients, they also go back to their medical doctors to get medical clearance letter for any type of operation that we are considering for these patients. If they have diabetes, they need to have a very, very tight blood sugar control, and if their blood sugar is out of whack or is not very well controlled, they're not a good candidate for surgery. People who are on blood thinner, they need to stop the blood thinner appropriately based on the type of blood thinner that they take, and that will be discussed prior to the surgery with the patient. On the night before surgery, we request my patient to have just a very light dinner and nothing to eat or drink after midnight of the surgery. They need to take a shower with a Hibiclins solution in the morning and come to the surgery center on time for filling out all those necessary paperwork. And we also want them to wear very loose and comfortable clothes. And in the morning, if they have high blood pressure and taking medications, they need to take those medications with the sips of water. But if they're taking medication for diabetes, they do not need to take that in the morning since they did not eat over the overnight.